Only on Eyewitness News, hospital diversions. It's what emergency departments do when they reach capacity, send patients arriving by ambulance to other hospitals.
Well, now we've learned hospital diversions have skyrocketed in Rhode Island in the last year.
Kim Kalunian sat down with the Department of Health and Nurses Union to find out why and what it means for patients.
Well, it's been about a year since Memorial Hospital's emergency department was ordered closed by the Department of Health. And today, Lifespan, the parent company of Rhode Island Hospital and the Miriam, tells me they've seen a dramatic increase in patient volume, and meeting that surge in demand has been among the most pressing challenges they've faced. When a hospital goes on diversion, ambulances carrying certain patients are sent elsewhere.
Ultimately, it's a system to help make sure that patients are getting care as quickly as possible.
Department of Health spokesman Joseph Wendelkin says diversions don't apply to walk-ins or people in critical need of care.
Someone who is in labor or someone who has an obstructed airway, for example, that patient will always get transported to the nearest hospital. And
while the Department of Health says diversions don't impact patients in the most serious need of care, the numbers are still up dramatically in recent years. According to data from the Department of Health, hospitals now go on diversion 7 times as much as they did 5 years ago, from 44 in 2014 to 322 so far this year. The total number of hours hospitals were on diversion also grew by close to 7 times, from 206 in 2014 to 1,343 hours as of late October. That's close to 56 days worth of time on diversion.
I absolutely think that Memorial closing has had an impact in the amount of diversions.
Memorial Hospital is probably one contributing factor.
The Department of Health also says roughly 15% of ER visits are related to behavioral health issues like mental illness and substance use. Wendelkin says they've started a census of patient numbers at emergency departments, psychiatric hospitals, and behavioral health centers.
Using those numbers, we're going to be making sure that people are getting care in the most appropriate setting.
Linda McDonald, the president of the United Nurses and Allied Professionals Union, says staffing is another problem.
How do we have enough staff that when these high volume times come, we have the capacity to take care of the patients in Rhode Island as they deserve?
And a spokesman for Lifespan says the decision to request EMS diversions is based on availability of patient beds at Rhode Island Hospital and the Miriam, not because of staffing. He also says the hospitals are making investments to physically expand their emergency departments and to add staff and equipment. I'm Kim Kalunian, Eyewitness News.